Hi, I'm gonna do a sterile change procedure. And for the pre-procedure, we need to check the doctor's order for wound care and the dressing change. We also need to check the nurse's notes for the history of the patient or what kind of dressing was done before doing ours. Also, so that we will know what kind of equipment and supply we will need for the procedure. So we need to wash our hands, introduce ourselves. We need to check the patient with two identifiers if we have the right patient. We need to explain the procedure very carefully so the patient will understand what we are doing today. And then we need to assemble all the supply and equipments, which are a normal saline solution, a 2x2 or a 4x4 gauze, extra sterile gauze, tape, clean gloves. We need 2 pairs of them, and we also need our dressing tray. After we gather all our equipments, all our supply, we need to assess the patient if he or she is ready to do the procedure. If he or she is ready, then we need to turn on the light, provide privacy to the patient, and raise the bed to a proper working height. After doing the pre-procedure, we are going to remove the old dressing. So first, we need to make sure that our area is very clean with no clutter. Also, we need to make sure that our bedside table is on a proper working height. And then we need to position the patient very comfortably, as well as drape him or her, and only expose the area where we will be working on. Okay, so I already did wash my hands earlier. I'm gonna put my clean gloves on. Okay, I'm gonna check on the wound and the dressing. So you need to pull out the tape very carefully. Okay, and then you need to check what kind of drainage do you see on the dressing. Is it a serous or a serosanguinous or a sanguinous or a purulent kind of drainage? So after doing that, removing your dressing, throw it on the garbage. And then you need to check on the incision or on the wound. You need to inspect for any signs of infection. What kind of a drainage is it oozing from there? And then is there any signs of healing? Is there any dead tissue or necrosis? So with all these facts, we need to compare our findings to the previous nurse's notes, and we also need to make note of any significant changes. So after doing that one, inspecting the wound, we're going to remove our gloves and then throw them on the bin also. So after inspecting the wound, I need to prepare my sterile tray. So considering or thinking that I am working on a bedside table on a proper working height. Okay, so I have my sterile tray over here and I have my saline solution over here. So I'm going to put clean gloves before doing the procedure. Okay, check my sterile tray. I need to make sure that it's not expired and make sure that it doesn't have any hole and it remains sterile. Okay, so I'm gonna open it on this side and take out my tray. It's a good practice also that you have a bin beside you, so whatever things that you don't need anymore, you can just drop them on there. Okay, so I'm gonna start opening my tray on the side that is far from me, which is that side, very carefully, making sure I don't contaminate it. And then I'm gonna do the two sides. The next side, under it, there will be the sterile forceps, which I can get. And then I'll just open it widely. So over here. And just like put it over there. Okay, I need to make sure that the tip of this forceps is sterile. Okay, so don't contaminate it. And also, like, only 1 inch of the sterile field is considered contaminated. The other, we need to make sure that it's controlled and it's always sterile. So after opening my tray, I will organize my supply in the tray. So first off, I have my garbage bag, which I will use later during the dressing. I'm gonna put it here for a while. And then I also have my sterile drape, which also I will use later for my patient. Just put it under him. Just put it on this side as well. And then I'm gonna rearrange or organize my other sterile forceps. Put it on this side. And I also have some swabs that I can also organize over here. And I do have a 4x4 gauze and a 2x2 gauze to use for cleaning later on. Okay. Now I'm gonna put my sterile forceps just above the 1 inch sterile field over there. Okay. Next one, I need to pour my saline solution. First off, I need to check the expiry date, make sure it's not expired. I also need to check the solution inside if it's clear and there's no sediments or any kind of dirt that's inside it. If it's opened already, it is only good for 24 hours. So make sure that it's dated properly after using it, okay? So I'm gonna open my saline. I'm gonna pour just a bit on my bag, on my on my garbage, just to make sure that I will pour the clean one on my sterile tray. So very carefully, I'm just gonna pour saline solution on my little container over here. Okay, and then I will just close that and put it over there, and I'm ready for my dressing change. Okay, so I already prepared and opened up my sterile tray. So I'm gonna do cleaning now of the wound and change the dressing. So I already done my sterile gloves, which I'm using right now. Make sure that I keep this sterile field sterile all the time. I don't turn my back on it, otherwise I'm gonna get it contaminated. Okay, so first off, I'm gonna get the sterile drape. So I'm just gonna place it under the wound, just to protect from any drainage. Okay, next off, I'll get my sterile forceps. I'm gonna get a 2x2 gauze and then soak it in the saline, drains it up a bit, and I'm gonna start cleaning my wound or my incision. So as we can see, this is a vertical direction. So what I'm gonna do, I'm gonna clean it first on the center, just one swab, don't lift up the gauze. Okay, and then throw it out on the bin. I'm gonna get another 2x2 gauze, soak it from the saline and drains it off a bit, and then I'm gonna do the side which is farthest from me, one stroke, one swab without lifting the gauze. Okay, and then throw it away. So I'm gonna also do that on the side which is near to me. same procedure, and then throw the gauze. Okay, so after that, I'm gonna dry it up using the same procedure and using the same technique. So dry it up on the center, get a 2x2 gauze, dry it up on the center, dry it up on the side farthest to me, and then on the side near to me. So if ever like you have a wound which is horizontal direction, you can also clean it from top to bottom, which is like a waterfall direction. Okay, so after that, I'm gonna get my dressing, 4x4 dressing, and then I'm gonna put it over here on my patient. Get a tape, make sure to secure it properly so it won't drop, it won't fall. Okay, and the dressing has been done. You can take out the drape and throw it away on the bin. So at this point in time, I can also take out my gloves and then throw it away on the bin, and then get all my sterile tray and all my forceps, everything that I use, all the dirty things, just throw them all on the bin, on the garbage. Also, we need to make sure that in case we turn our back into our sterile field, we need to repeat the procedure over and over again. Or if we make any mistake, or we made our sterile field contaminated, we need to make sure that we start the procedure again. Okay, so everything is gonna be thrown out, okay, on the bin. And then after that one, we're gonna ask the patient, how are you? How is the pain? Do you have any pain? You're good? Okay, ask them if they are comfortable. Okay, I'm all done with the procedure right now. So I'm gonna give you your call bell. I'm gonna lower the bed and then put the rails up, all the safety precautions, and then you can also ask them, do you want me to turn off the light for you, or you want it to leave open? Okay, and if there's anything that you need, then you can always call me, press your call button. Okay, so that's how we do our sterile dressing change procedure. To sum it all up, the sterile dressing change procedure is not easy. It is very critical. You need to be careful when you are doing it. You need to not contaminate the sterile field, otherwise you keep on repeating it again and again. So make sure before you do it, you are confident in yourself that you can do it. As well as every procedure, you need to wash your hands and sanitize them. That's for your own safety, so you won't get infections. So any abnormalities, like any swelling, sign of infection, or any sign of like serosanguinous drainage, or any sign of hemorrhage on the incision, you need to report it to the RN, and you also need to document your procedure. You need to document what time you did it, what kind of dressing you've done, as well as how did the patient tolerated the procedure. You need to document the drainage, any, like if there is any signs of infection also on the incision site. Okay, I've learned a lot from this procedure, and I hope I will be doing it very well in the future. Thank you for watching.